This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center. I'm going to discuss whether benzodiazepines make ketamine therapy less effective. And this is a frequent question that we're asked at Nova Health, is whether or not the benzodiazepine that the person is on, such as Valium or Klonopin or Xanax, will decrease the efficacy of ketamine for its antidepressant effect. And in short, the answer is yes. Basically, antidepressant effect of ketamine is dampened by the use of benzodiazepines. And we have a study here with Andrashko's group, in which they took a look at 47 patients who were given a single dose of 0.54 milligram per kilogram of ketamine as an add-on to therapy with antidepressants. They found that 28% of the patients had a 50% reduction in their depression scoring systems, and noted that looking at benzodiazepine users, 40% of the patients that were in this study population were on benzos on a regular daily basis, and that benzos were used in significantly higher amounts in non-responders than responders, such that in non-responders, the individuals using greater than 8 milligrams of Valium or diazepam daily had worse outcomes or less response. In fact, they had significantly worse outcomes on day 3 and 7. So they felt strongly that higher doses of benzos decreased ketamine's response. And basically, the response was noted that individuals with lower baseline depression and anxiety scores had a greater response. But those with greater than 8 milligram per day of diazepam equivalent predicted lack of response with a high sensitivity of 80% and specificity of 85%. And that basically patients receiving such high doses had lower rates of response than those who were not using benzodiazepines. It was 8% of the users of benzos had response versus 35% of the non-users of benzodiazepines. And these effects were noted especially at day 3 and day 7. And so in this particular study, they felt that higher doses of benzodiazepines decreased the efficacy of ketamine. And we could kind of see why this might happen if you look at how ketamine works in the neurons. And so this is basically a glutamate system here, in which we have pyramidal cells in the prefrontal cortex, which are involved in the release of glutamate for the process of a number of different things, such as learning and obviously transmitting information. And we have here the presynaptic neuron, where the signal comes from, and a postsynaptic neuron, but also we have a GABA interneuron here. And these two neurons here, the presynaptic and postsynaptic neuron, basically involve the use of glutamate, whereas the GABA interneuron is involved with the production of GABA that inhibits the presynaptic neuron from releasing glutamate. And so when the GABA interneuron is on, it shuts down the system. But when you turn the GABA interneuron off, it allows a glutamate burst. And what controls this or stops it would be the NMDA receptor, which is where ketamine works. And ketamine shuts off the NMDA receptor, it blocks it, and it then blocks this GABA interneuron, allowing for a glutamate burst. And effectively, once that glutamate burst happens, we have glutamate that interacts with the AMPA receptors, causing a depolarization in the postsynaptic neuron that ultimately releases brain-derived neurotrophic factor and ultimately the production of protein through mTOR activation, which is seen here in the lower right side. Now, the presence of benzodiazepines causes the GABA interneuron to basically stay on, and it's difficult for the ketamine to actually shut down the GABA interneuron. And so effectively, we just kind of summarize this again, that benzodiazepine basically increase inhibition of pyramidal neurons, and it counteracts basically what ketamine does in shutting down those GABA interneurons, resulting in decreased synaptic plasticity. And it also will decrease ultimately AMPA activation, it'll decrease mTOR activation, and so benzodiazepine presence decreases the ability of ketamine to cause the depolarization of the glutamate neuron signaling pathways, and this effectively results in failure of ketamine to cause antidepressant effects. And so in a slightly larger version of this, again, the GABA interneuron plays a key role here because the presence of those benzodiazepines keeps this system on, preventing glutamate to be released ever so briefly and do its thing. And we know that individuals who are depressed frequently have anxiety associated with that depression. And a lot of times benzodiazepines are frequently added to initial therapy with antidepressants, such that in one study, which was done by Josted, noted that 12.5% of patients were initiated with benzodiazepines along with their antidepressants. And 12% of those individuals ultimately became long-term benzodiazepine users. So a lot of patients fail to withdraw from benzos after the acute treatment with antidepressants. And so there were other studies that benzos will slow responses to ketamine. The study with Albert and his group in 2017 did a post-hoc analysis, and they studied the effects of benzo treatment with antidepressant response in 6 ketamine infusions, where they used 0.5 milligram per kilogram Monday, Wednesday, Friday for 2 weeks. And they had 13 patients, 4 of which were on daily doses of benzos, approximately 2 3/4 milligram of Ativan or lorazepam equivalents. And they noted that there was no statistically significant difference in depression response, rate of remission, or in depression relapse in 28 days, but it took longer for people on benzodiazepines to get antidepressant response, and a longer time for them to get depression remission, and a shorter time for them to have depression relapse. So the use of benzodiazepines take longer for an individual to get antidepressant effect with ketamine, and it's a shorter time for them to actually lose the antidepressant effect. So further reviews by Fry and his group showed in a post-hoc analysis that benzodiazepines gave no significant difference in response as well in 10 patients with treatment-resistant depression. And then in these individuals, the patients were on 0.75 milligram lorazepam equivalents daily. And that was basically that their results were lower in the responder group versus non-responder group. But effectively, that these individuals did get response, but on the other hand, though, individuals with benzodiazepine use actually had a slower response rate. And so, again, the benzodiazepines don't totally block ketamine's effect. It just takes longer for the ketamine to actually work, and the relapse rate is quicker. And one other study with Crystal and his group in 1998 demonstrated that lorazepam reduced emotional distress and also reduced the distorted sensory perceptions associated with ketamine infusions in 30 healthy individuals. It also reduced the inability to produce a proverb interpretation. So individuals getting ketamine usually have a certain amount of thought blocking that occurs, and the use of Ativan reduced this thought blocking. And so it basically demonstrates that ketamine does interfere with certain perceptual changes ketamine traditionally produces. So, again, there has been a number of studies in anesthesia as well that showed that the use of benzodiazepines and ketamine basically interacted by the benzos, making ketamine slightly less effective in terms of anesthetic purposes as well. So the use of benzodiazepines increases treatment-resistant depression. And this is the problem with benzodiazepines. A lot of patients complain of anxiety and they want rapid relief. And in this review by Gordon Parker and Rebecca Graham, they noted that treatment-resistant groups, generally are older, had longer depressive episode durations, higher number of comorbid medical and anxiety disorder, lower education, and were less likely to have full-time employment. But they also reported less trait irritability and were more likely to view medication as being a contributor to their current depression. And they noted that benzodiazepine use, which was more common in the high treatment-resistant group, with both melancholic and non-melancholic subsets, was present. That basically benzodiazepine use was the key finding that was present in all individuals with treatment-resistant depression. So the salience of benzodiazepines is that it's just a marker that the individual is going to have really difficult to treat depression. So in the conclusion here is that higher doses of benzodiazepines can certainly delay the time to response and remission with ketamine therapies for depression. And it also shortens the overall antidepressant effects of ketamine. But using enough of the ketamine infusions and obviously with periodic boosters, this can certainly be overcome. And higher doses of benzodiazepines certainly predict a non-response. So those with really anxious depression on high doses of benzodiazepines tend to respond slower or sometimes not at all to ketamine. But we find that rapidly stopping benzodiazepines prior to getting a ketamine therapy can be harmful because the individuals can basically have increased amounts of anxiety and increased amounts of mood disorder that, again, ketamine might not be able to overcome in a rapid fashion. Effectively, the benzodiazepines should be tapered in a slower fashion over a longer period of time, along with the addition of traditional medications to treat anxiety type disorders. But effectively, though, what we find at Nova Health is that most of the patients are on benzodiazepines, and that you can certainly get great response with ketamine infusions during this period of time to treat treatment-resistant depression. But certainly, higher doses of benzodiazepines can slow the whole process down, but it won't absolutely stop it.